And we're back. Welcome to Healthcare Quality and Risk Matters after show. My name is Gary Bierce, and I'm being shadowed, as I said in the original show, by my esteemed colleagues, Rob Santamore and Dr. Timothy Brown. If you're joining us in the after show, we're going to quickly go over some of the big topics we went over in the main show about healthcare quality. But we're going to really dive in on how Aperitisoft Healthcare can help you chip away at those costs. So, Rob, if you could dive in first to your calculator, and let's share with our after show people what's in those numbers, and then let's spend some time talking about them specifically. Timothy, if you can help us to connect some dots and how having the right software systems can help you reverse some of these costs.
For those of you that are listening only and don't have visual for this podcast, I will narrate what is up on the screen. We have a calculator that we built about the hidden costs of poor quality. There's where you can actually put in your organization's revenue. There's then select a percentage of your efficiency. So how high is the efficiency for your organization? You can select the total dollar amount for malpractice lawsuits. Or other settlements such as like missing belongings. There's fines, penalties like hacks or readmission penalties. You can enter your turnover rates. There's for all staff. You can also enter in the percent below target for your individual service line. There's KPIs, including patient volume. And you can enter any other loss of service. There's a systemic problem right now across all healthcare where hospitals are closing service lines that are not able to be sustained with low reimbursement rates. And then any other losses such as pay for performance, there's loss of grants, there's any other known costs to your organization that would otherwise be made obsolete with solid quality programming. The calculator starts with $1 billion revenue example hospital, and for a middle of the road, there's healthcare facility. And again, I'm going to emphasize middle of the road healthcare facility. We're showing off of $1 billion, $153 million plus thrown in the trash. And I do mean thrown in the trash, right? This is not money that had any use. It was just thrown away. So we're left with $864 million out of your billion.
Wow. So when we look at these numbers, I mean, it's quite amazing to me that quality has tentacles, right? So the quality of care has tentacles that go into all these different areas. And we mentioned it in the live show. Most CEOs don't connect all these dots.
No.
They're just not thinking this broadly. And it's a big number. I mean, even if you're a $300 million hospital, you're talking about $45 million worth of cost.
Correct.
Yep.
And that's the average size hospital in America, about 300 million.
Yeah.
Well, look at that hospital we talked about last month or the month before. There's right in Ohio, a $25 million. Shut them down. An entire community without care, over 25 million. And so these are huge numbers. If healthcare executives don't start considering the cost of quality in every aspect of their operations, they're going to continue to lose service lines, which is going to continue to drop their revenue. They're going to continue to lose staff, which is going to continue to drop their revenue. They're going to continue to get sued, which is going to drop their revenue, right? I could just keep going. So it's very frustrating for me, as a quality professional, to watch these things happen when there's solutions out there.
Well, let's get real practical. Okay.
Yeah.
Let me get real practical here. So I'm going to ask a question of both you guys. All right. So take turns. Whoever wants to go first, doesn't matter. Okay. Aperitisoft Healthcare has, in many ways, revolutionized how you manage incidents in a hospital.
Yeah, absolutely.
Right. We triage an incident coming in. You can determine its criticality right away. Therefore, speed up your response times in terms of investigation and analysis, and getting all integrated to the corrective action and preventive action plan that could then be monitored to its completion, which is then all lumped into an overall quality score where you can be monitoring how your quality is doing throughout the course of history and time in the hospital. Okay. How does that, the ability to have that alone, affect those numbers? And I'll throw
drastically. So
wow.
Don't fight over the answer, guys.
I'll say, right? Do you mind if
I'll let Rob. I'll jump in afterwards.
So I have such strong opinions on all of this, and I say opinions, but it's 12 years of watching facilities fail. There's despite quality efforts. There's that I'm forming that opinion off of, right? So like this is objective evidence that we could easily pull to say there's these solutions are needed because things are falling through the cracks. So like even looking at our calculator, for those of you that can't see it, there's picking any, there's random points, settlements and lawsuits. Mm-hmm. There's so the example that we used, we're $9 million in settlements, lawsuits. There's in settlements, I'm talking all settlements, right? Because hospitals don't always consider all settlements.
Right.
There's the payback that we did for the family. There's the reimbursement. There's for lost belongings because we threw grandpa's computer away. I can tell you every hospital I have ever worked at pays out way too much money for all of those things. And you end up settling on lawsuits, in some erroneous because you have no documentation to support how you manage the incident that sparked the lawsuit. Right? There's in the court of law, who's going to win every single time? There's the one who has the better documentation.
Better documentation. You're absolutely right.
Every time, who can prove their case the best? And if you can prove as a healthcare facility that the incident was entered, you quickly and intelligently acted on it, you then, there's mitigated the problem, there's reduced harm, right? And then we tracked performance around any other efforts to prevent something like that from happening again. You're going to win because you're going to prove that you did all the right things for the right reasons. And grandpa got out of bed not wearing his slipper socks, even though he was educated and he had the call bell within reach and he had the side rail up and he did teach back education on fall precautions. He chose to get up and fall. That was a patient choice. That was a patient choice fall. If your documentation shows that, you might not have to pay that, right? They have to prove that you're negligent. They have to prove that you failed in a standard process. Nursing did something that otherwise every other nurse would be expected to do. Physicians did something that otherwise every physician would be expected to do. If you can prove that none of those things occurred, there's your $9 million right there is going to drop to potentially 6 figures. You're never going to be perfect. We acknowledge that.
Absolutely.
Yeah.
Hey, Rob.
Sorry. Yeah.
No, you're good. I want to kind of touch on that point that you just mentioned, though, with grandpa falling out of bed. I know it's a hypothetical situation. However, building out a better quality system for your organization means that maybe grandpa doesn't get out of the bed at all, because now you have processes in place that reduce the likelihood that grandpa is by himself anyway. So we're looking at that. We're number one, if he does fall, we have a process in place to mitigate that situation. However, we're also going into the proactive approach of now we know that this high risk person may be in the overall room. So now we have better protocols put in place to ensure that our higher risk patients that could potentially fall have the additional care, the additional assistance to be able to get out and maneuver around the organization. Because we're talking about real lives here. We're talking about real dollars for the organization, but we're also talking about real lives for patients, the experience for our employees as well. All of that is better when you have a quality system that can track and identify these overall incidences that are reoccurring in the organization, and you're mitigating, reducing, and dropping the likelihood that these issues will happen in the future as well.
Yeah, thank you for continuing that, because yes, there's the mitigation efforts are extremely important, especially when it comes to some of those for-cause visits that you might get, and then any additional fines and penalties, right? Not only did we have to pay out Grandpa, even though we did everything right, but now we have to pay out the State Department of Health or otherwise.
Correct.
Because we can't prove that we did everything right again. So we have continued cost of poor quality on the same incident. There, and what's going to cause high fines in that space is if they show there's a systemic issue, right? How widespread is that, right? Joint Commission is going to say how widespread. DNB is going to say systemic versus not, system of quality versus not. You have to prove that you're doing all the right things for the right reasons for that incident and preventative action, to your point.
Correct.
And having it all traced through the same system, like Aperitisoft Healthcare, right? There's, to Gary's point, incident investigation, after triage analysis to workflow management, right? And then into all of your CAPA's milestones, tracking of cost of quality, into your dashboards that help you make correlations and even give you base evidence for causation assessments, right? So thinking of Grandpa falling out of bed, we have additional preventative actions that we can formulate later from a high level assessment. Our HCAP scores are dropping because of poor nurse communication, poor nurse education. Well, hold on, if we're rounding every hour and we're doing really good nursing education, nursing communication, our patients understand what's expected of them. Part of their responsibilities of being a patient, right? Every patient has a Bill of Rights and responsibilities. If they violate their responsibility, that's where we win the suit. They have a responsibility to abide by the care. There's directions. They didn't. And we can see in the HCAP scores that those things are correlating, that we didn't communicate well, or we are communicating well. And we can say nurse rounding needs to improve. And those are very easy pieces to put together for quality people that have data. You have to have the data.
The data.
And if you don't have the data because you're doing it in Excel or a marble composition notebook, which is how I started doing it back in the day, and I say back in the day, 12 years ago, because systems don't exist, you end up with, there's such a short-sighted view of your overall organization, and you miss all of those key pieces that solve problems like Grandpa falling out of bed and the lawsuit that comes with that and the patient impact of that.
Rob, speaking of that marble notebook, I think about the disparate systems that happen in organizations. So maybe you do record the incident. However, if you're in multiple systems trying to get this information extracted from one, transferred over to the other, that human error often can happen, where these incidences may go unnoticed, unclaimed, completely forgotten about into the world of abyss. And often that's what causes that overall lawsuit. Maybe we did record the incident, but there was no follow-up to it because you put it in one system, you needed to transfer it to another system or 2 or 3 other systems that have this information in it. And that leads to that issue of, did I record it? I don't even know where I recorded it. I mean, so that can often lead to miscommunication across departments, which reduce the likelihood that you are able to mitigate those overall situations in your organization.
Agreed. There's an actual gap there, right? Quality is all about closing gaps to make sure that there isn't an opportunity for additional risks to seep through, right? We want to keep risk to the side.
Let me ask you guys this question then. So you've talked about how Aperitisoft does it. Aperitisoft Healthcare does it.
Yeah.
What's going on right now?
I knew exactly where you were going with that, which is why I chuckled. So we joked about my marble composition notebook from 12 years ago. I've seen that as recently as this year.
Correct.
Where we're doing paper and pen documentation, there's to address incidents, which is to me insane. Right? It's so antiquated at this point, and it's so behind the times of every other industry.
People are going to say, "Oh, wait a minute! I use Datex, and they give me an integrated system."
Great. You know what? Datex is one of the better ones out there, but it's still just a database. you're dropping information in, and it takes users to go in, either move the data, manipulate the data. And I say data, I mean there's the actual like information within there.
So moving it from one step in the process to the other.
And you have to move it. There's as far as workflow management, it even lets you do some of that, but it doesn't. Give you a triage score that allows you to say, okay, you know what, the building's on fire, sometimes literally. And what do I have to attend to today? I need to attend to my incidents in the red because X, Y, and Z happened, and I need to protect my patients, I need to protect my people, and I need to protect my facility. So if that's all I can do today, I know that I can go there. Frankly, they don't have the aggregate. There's data at the end that allows you to essentially hit export to PDF or Word or Excel, and you be able to present there's your QMOC, your QAPI, for all you there's quality people, if we have CFOs or CEOs listening, what I mean is whatever your quality management or governing board processes are, that you're required by law to have, right? All of your data is at fingertips, right? You can just export it, and then you can make resource decisions. I need to hire a trainer, I need to hire staff, I need to allocate, either educational resources or float pool, right? So even your morning huddle, you're looking as the executive team and you're saying, I am short-staffed across the entire hospital. And you know what? We have had not only horrible throughput through the ED, but I've had 17 incidents come in per hour in the ED. And I'm almost exaggerating, but not really. So if I'm going to allocate resources as far as my extra staff per my dashboard, I can allocate them to the emergency department because it's right now an identified high-risk space.
Mm-hmm.
Sorry, that was a very long answer.
All that being done, right? What's amazing is that a lot is being solved, and we talked about that in the main show, Timothy, solving problems.
Yeah,
a lot is being solved by just integrating the incident management process front to back.
Yep. And we solve everything. We can track where we're losing finances. We can track where we're losing patients. We can track where we're losing anything. And it's so simple. And I don't understand the reluctance healthcare has to change when the entire industry is built on being innovative to improve patient care. And yet
we're not willing to be innovative to manage the hospital.
Right. It seems like we're managing in this like oxymoron type world. Where we're just not making logical decisions, honestly.
There's a level of risk that comes with it, I believe, too, of healthcare organizations that I don't know if they're just ready to make the actual change that they've committed to say they're going to make. When it comes down to breaking the barriers and stepping outside the box, I've noticed a trend for healthcare. No one wants to be first for fear that it does not work. And I think that's where many healthcare organizations are just kind of stuck at. Who's going to go first? Who can we blame if it goes horribly wrong? Or if it's amazing, can we at least be at the top? So I think it's one of those issues of the fear of being first, or the fear of being in the forefront, whether that's good and or bad. That's just my theory on it.
Definitely get into the forefront then, Timothy. Let's talk about getting proactive. So in Aperitisoft Healthcare, we give what we call it the audit module, but really what it does is give hospitals the ability to create projects, compliance projects, or pre-audit or self-audit projects based off of standard to get themselves ahead of the curve before the auditor arrives. So I'm going to ask you guys this question. How does that relate back to those various cost of quality items? And how much of an impact would that have if a hospital's using a tool like that to be prepared, basically, is what we're saying.
I'll jump first. It takes the surprise out of the surprise audit, is what I like to always say.
Yeah.
An audit should never be a surprise. If you're doing what you're supposed to be doing based off of your overall qualities for your quality standards for your organization, a surprise audit should not be a surprise. Other than the fact that there's a person at the door asking questions, if things are aligned the way that you say they are, this should not be a full-on panic mode. I've seen Jaco show up at the door, and I've seen the executives panic. And I want us to take that panic out of having Jaco at the front door and turn into that proactive of saying, hey, we've already audited ourselves. We know what areas that we need to work on. Have your information readily available. And that's what a pair allows you to be able to do. You have the questions already. You know what they're going to ask. You know what areas you might potentially be struggling in that you need additional assistance in. But having that information readily up front and available and showing and being transparent and saying, hey, we know our emergency department might be not its best overall, but these are the processes that we put in place to reduce any types of incidences or to ensure that we're going to build out a better process for the organization. Jaco sees that. Not going to say always you're going to get out of the penalty, but at least you'll put it in good favor to reduce the overall ability to receive penalties, because you know what you've already put in place, and they understand that you have processes put in place to reduce those overall incidences. That's how I look at it. But Rob, your perspective is.
Well, how does it affect the cost of quality? What Timothy's saying there. So
drastically.
So what line items on your calculator would you say are immediately affected by what Timothy is saying we're going to do for them?
There's a bunch. I think that you can, well, actually looking at it now. So for those of you that don't have visual for this podcast, I popped up the calculator. And to Timothy's point with being proactive with your assessment so that you're always ready, you know when they're coming. And when they do show up, they're not going to find something that you already didn't if you're using intelligent tools, right? Mm-hmm. So process efficiencies, you're going to reduce your inefficiencies, right? Because you're going to identify the gaps. There's how much you've paid in settlements malpractice. You've identified the gaps. So you're reducing lawsuits. You're reducing, there's the incidence of the number of dentures that we've thrown out on the food tray, which is a staggering number, by the way. Mm-hmm. There's, and those are like 5,000 a pop. There's how much fines and penalties. Timothy just addressed that. Staff turnover. There's reducing risk and showing continuous improvement, and part of your tracer, right? It's part of your assessment in quality and having an intelligent tool like Aperitisoft is you can put out surveys and have other people have a say. There's give information. You can gather information from everybody, and then they can see that we are improving processes. So your staff turnover goes down when they're working for a system of quality. There's targets below, service line bench or KPIs below service line targets. There's very easy, right? A simple quality assessment. Is part of your initial audit, as what our module calls it, is going to show that, hey, we're not meeting the number of whatever, right? Mm-hmm. We're just not meeting that KPI. So I would argue that every one of our functions, there's impacts. There's every element of quality across the organization, because it's going to impact patients. It's going to impact staff. It's going to impact risk overall.
Wow, you pretty much checked every box.
Sorry, I also know I'm a little intense about this, but it's just been so frustrating for so many years, and there's finally a tool out there, so I'm so excited. There's for people to start making real change, right? I'm tired of Band-Aids. I'm tired of, all right, well, we have QPulse, but hold on, well, we don't really have a good system to then manage. There's our CAPAs, or we don't have something that really does a good job with audits. So, well, now we have to add them in, or we have Midas. So now we need a document control. Now we need CAPA management. Mm-hmm. Now we need, there's that. I mean, that is insane to me. You wouldn't do that. Dealing with a person, in healthcare, right? We're all about improving the body systems.
What's amazing, guys, is that we've came up with this revolutionary, I should say revolutionary, but groundbreaking
I agree.
change in how we do incident management, fully integrating things front to back. We then provide the ability to manage audits and any kind of self-assessments, compliance assessments, risk assessments, if you want to do them in the system as well. But we don't stop there, do we? We also give you the ability to manage your documents as well and have that all in one place. So I'm going to throw this to you guys. How valuable is that to have it all right there at your fingertips?
So valuable.
It is very valuable.
It protects the patient, the hospital, and the provider. So and I could go in depth as to how each document protects them. But it lets everybody know the expectations. And if you can't find something that dictates your job that is designed to protect you and keep you within scope and expectations, then you don't have a leg to stand on when you're getting sued, and the hospital doesn't have a leg to stand on when getting sued. There's a huge portion of my job is pulling up, there's regulatory requirements, and everybody listening to this, and you both know, many of them end with and reference your organization's policy on this.
Policy,
right? There's everything from HIPAA breach notifications and how you manage that. It's based on really how you wrote your policy as to whether or not you're going to be liable to an extent. All of those things protect you, your license, your patients. And if you're having to search through a giant blue binder, they bring into the operating room, which is against every AORN standard because you have loose paper in an operating room. Which is a contamination risk. And you're flipping through to find the protocol. There's on what to do if your sternal saw breaks. There's what other tools are approved for use by this facility. And you don't have that, so you make a choice and your patient suffers injury. Everybody's liable. Document control is so important.
Rob, to that point of having the big blue binder in the operating room, I'm like, protocols, policies, they change often. So getting the newest and most updated protocols sometimes can take some time for different areas and organizations, depending on where you're located. But having the electronic version, having the most updated, having a time stamp on the actual document lets you know that you're using the most current information, easily accessible from any phone, computer, however you decide to access it. And then knowing that, if there is a new protocol for the operating room, that everyone is going to get it at the same time, without a doubt. It's in your folder. It's available, and it's time stamped as new protocol document. So it's already in there, there's going to be new. So you'll get the email. It'll be within the overall Aperitisoft system. To me, that's just peace of mind for the organization to say, hey, I know I'm using the most up-to-date information. If there's a protocol that needs to be removed, it's just as easy as removing it from the overall system as well. So having that information in there lets you know that you're working with the most up-to-date processes and protocols for your organization. You don't have to second guess the chance to say, well, did we update this? Is a new paperwork in it? Do we need to call, the supervisor? However, no, the most accurate information is right at your fingertips whenever you need it.
I worked for
invaluable
organization where I managed 4 buildings, and the compliance officer's policy was when she updated a policy, I had to drive to each of the 4 buildings. There's the document, replace that document with the old one in the binder of the med room, of the other buildings.
Wow.
And what a huge risk, because what didn't happen when I wasn't there and she did a policy update on Friday afternoon. It just didn't get updated. So all weekend we did something different at every building because I didn't check my mailbox.
Yeah. Well, we really picked that apart well, I think, guys.
Wow, we're already at time. Crazy.
Bring us home, Timothy. What is the final word? How can we wrap this up today?
I'm going to go back to what I said earlier about bite-sized choose when it comes down to making this improvement, making these changes for your overall quality system. Remember that improving the overall cost of healthcare requires really a comprehensive quality system that's designed to address those overall unique challenges of the overall industry. And the first thing I said earlier was really you have to adopt a data-driven quality management system. This will help you to prioritize your overall real-time data collection and analysis. Aperitisoft Aperitisoft Healthcare will definitely help your organization to identify those overall areas with our ability to triage your overall incidences, knowing what's the most important, what's the most pertinent, alerting you right away when those incidences come in based off of our overall triage score that's built specifically for your organization, which is great. And then you're able to utilize our tools to create CAPA management, which is your corrective action plans, to identify ways to reduce the reoccurrences of these overall incidences as well. And then document control is just in there, which is just a major advantage for any other system for quality because you have everything within one wheelhouse and you're not looking at multiple systems that are disparate, trying to find the most recent or most current information. Everything's right at your fingertips, available for you as you're overall building out your processes to improve your quality management system. You want to implement standardized care protocols. You want to engage and train your overall workforce. You want to integrate continuous improvement processes to ensure that your organization is making those strides forward. Those are all low-hanging fruit. Last but not least, foster that leadership, accountability, and support. You need your executive team, but the way that you pull your executive team on board is you present them with proven strategies to be successful. And that information can come straight from the Aperitisoft system. We have the overall calculator to help you be successful, to build out your case for this. We have white papers available as well. So don't hesitate to call us and contact us if you have questions about how you can improve your overall quality, how you can build your case for quality for your organization. We're readily available to help you make those choices and changes.
Now, if you are a average size hospital, that 150 bed hospital size, Aperitisoft, we've made it very affordable to you. You can get this software for a couple $100,000 a year, fully integrated. But don't let that shock you. We can stage it in. We can find ways to make you get into this software over time, show those benefits one bite size at a time to management, so that you can get the system you need to reverse a lot of these cost of quality problems you have in your organization. So give us a call, reach out to Timothy, reach out to Rob, reach out to me. We'd love to be able to help you solve these problems and get you on the path towards superior quality and even an HRO, if that is your goal for your organization. Any final words, guys, beyond that? If not,
that sums it up.
Until next time, folks, we are so happy that you tune in to our after show and watch us live. Without you, we couldn't make this happen. So we appreciate your support, and we'll see you next month.
Awesome. Take care.
Bye, all.
Take care.